Today I will be speaking on a very important topic, which is the visual disturbance. This can present to the emergency room, and we know that vision is a very important problem when there is a loss of it. Sudden visual loss can be a common problem which can be seen by both the ophthalmologist, neurologist as well as by the emergency room physician. Before we go into the actual causes of loss of vision, let us see a basic of the anatomy. You all know this is the eyeball, and the outermost layer what we have here is the cornea, and this is the transparent one is the cornea, and then you have the conjunctiva around it, then the iris, the pupil, the lens, the vitreous, the retinal arteries, veins and the optic nerves. And it is very important that any disorders in the optic nerve, retina, vitreous and any other parts of the anterior visual pathway also can produce loss of vision. Blurred vision can occur even when you have some disorders in the cornea, where the cornea becomes opaque. The loss of vision can be either partial or complete. We will deal about it later. Can also have binocular diplopia or an uniocular diplopia, that is diplopia looking with both the eyes, and when I cover one eye the diplopia goes away. And uniocular diplopia is even with one eye I may have a diplopia. The causes are very different. Sometimes the disturbance in vision can be where parts of an object are missing. I am seeing something, one part of it I am not able to see. Sometimes it appears as if the whole thing is faded, the color is run out, as if it is a red color, it looks as if it is a faded red color. And sometimes symptoms are so variable they are not able to tell it. They see some bright spots and then it goes away. And they also can have difficulty in identification of an object. They may see a pen and may not know what to do with it. And then they may wonder what to do with it, and then subsequently they realize that it is a pen and they can write. They have difficulty in matching colors, matching faces as well as numbers. All these can occur abruptly also and can present as a visual disturbance, and they may come to the emergency room with any of these symptoms. So, when patient comes with these symptoms, what all we will test? We have to test the minimum is the following: visual acuity, whether the patient able to see distant vision, near vision, the central vision, the color vision, as you know, identify the different colors, the field of vision, to what extent they can see laterally, up, down as well as in the center, fundus examination. And it is very important to see the pupillary size reaction, we will be dealing with it later, the eye movements, and definitely other systemic and neurological examinations will have to be done. This pinhole, this is a very good instrument to see whether the vision improves when you see through the pinhole. One eye is blocked, and when you see through the pinhole in the other eye, if the vision is better, then you can think that this could be something with connected with the refraction. Then ACRI chart is the one which we have been using for number of years. We have two contrasting colors and the patient should be able to identify the number in the color. If they have some visual disturbance in color perception or color blindness, they may be unable to identify the colors properly and they may not be able to tell us the numbers. Then important is the fundus examination. We have to see the color of the fundus, the vessels, the fundus, the arteries, the veins, and we also have to see the complete retina and the macula. Visual field is assessed by using an instrument where the charting comes like this. In this you can see this is a blind spot which has been enlarged here and it is an abnormal one, and these are some of the tests which help us to identify the cause. And here is the Amler's grid. Then you can find that in disorders of the retina there can be macula, there can be metamorphosia, and these straight lines may appear something like this, they can be a dark one, maybe this is a retinal problem. And these are all some of the tests which are helpful.